First of all, I want to congratulate you on your current pregnancy. You mentioned you're 11 weeks along, and that's so great. I'm very excited for you. But it also sounds like you have a complicated history and you have some really good questions about natural childbirth. So I want to start with your first pregnancy and delivery. You mentioned that they had to start Pitocin and that you almost had an emergency C-section. And I want to address that topic for a second. A lot of people feel, and they've actually heard out in the community, that if you come to the hospital, we're going to start Pitocin on you and that will make it so you have to get an epidural and then you'll get a C-section. Some people believe that that's actually the natural course of things when you come to the hospital. And that's totally a myth. So the reason why your doctor started Pitocin on you was to increase your chances of having a vaginal delivery. Our goal in giving you Pitocin is to increase the intensity and frequency of contractions in order to get your cervix to dilate ultimately so you can deliver vaginally. Pitocin is a very safe drug when used under the appropriate conditions, on a pump, well regulated, while your baby is being monitored. So I'm guessing there was some other extenuating circumstances, some other unseen forces going on causing your baby to have stress and almost need an emergency C-section. A lot of women feel that if they get Pitocin that they'll need an epidural, and that's not necessarily the case either. Pitocin just takes you from 0 to 60 faster. So imagine a chart with a curve that just goes up like this very gradually. That's kind of how natural labor goes. Your contractions start out not being as frequent, not as intense, and they gradually work their way up to the most intense contractions you're going to have and that you need to have in order for your cervix to change. Pitocin just kind of cuts out, the first part of that graph and takes you from 0 to 60 faster, getting you to where you need to be for your cervix to actually change. So the contractions are going to be intense and frequent no matter what. Pitocin doesn't hurt more. It just hurts faster, if that makes any sense. So Pitocin isn't a bad thing. Now, your second delivery, you mentioned that you had to have a C-section because your baby was breech, but the doctor wouldn't turn the baby. And sometimes it's not an option to turn the baby because of the surrounding circumstances. I'm guessing your doctor did an ultrasound. And sometimes on ultrasound, we discover that the placenta is not in a good location or the cords around the baby's neck, and it would pose too big of a risk to the baby to try to turn them. And so a C-section is our best option in order for you to have a safe delivery. Also, if you were in labor at the time, turning the baby isn't an option because we can't safely do that while you're contracting. So now that brings you to this pregnancy. You want to try a VBAC, you want to do natural childbirth, and a VBAC is definitely possible after having only one or even sometimes 2 C-sections in the past. It depends on your pregnancy history and the reasons for the C-section. But if this baby isn't breech and there's no other circumstances that would necessitate a C-section from square one, then a VBAC can happen. But your doctor may have been hesitant in saying that it would be okay because there are inherent risks. So when you had a C-section, they made an incision on your uterus to get the baby out and stitched it up. And chances are it healed nicely, but it's a weak point forevermore. So this time when you go into labor, there's always a chance that it could be stressed and that weak point can burst. Similar to if I were to make a big incision down my bicep and I started lifting heavy weight, it could cause it to pop open. Now this is called uterine rupture, and it happens 1% of the time. So 1 out of 100 ladies who are attempting a VBAC or a vaginal birth after a C-section will have a uterine rupture, and this can be life-threatening to moms and babies. So we want every patient to know who wants to do a VBAC before they even go into the process, that this is a risk. This is something that could happen. And because of this, we need to deliver you doing a VBAC under the right circumstances. We need to deliver you in a high-risk hospital that's capable of handling an emergent situation like that, capable of doing an emergency C-section right away if it had to be done. And in most cases, it's protocol to have an epidural at least in place. And the reason is because obviously you need anesthesia when you're going to have a C-section. We have 2 options. The safest one is an epidural, for a lot of reasons. Number one, from a patient's standpoint, it's good because you're awake. You're aware of what's going on. You get to be present for the delivery of your baby and hear them cry for the first time. So that's good from your standpoint, but from a medical standpoint, an epidural doesn't affect a baby at all. They don't know that you have it, and it's very safe for them. But on the other hand, if you don't have an epidural, we had to do an emergency C-section or your uterus ruptured or something, our only option for anesthesia is general anesthesia. And this is the kind that you get when you go to the hospital and get your appendix out or something, where we totally knock you out. We have to put a tube down your throat and breathe for you. And if we're doing this to you, this medication is getting to the baby, and it does kind of do the same thing to them, just put them totally out. So when they're born, sometimes we have to fully resuscitate babies who are born to moms who are under general anesthesia. And that's not the best way to start life. So we try to avoid that at all costs if we can. So it would be best for you to go into this with an open mind, for the safety of yourself and your baby. And if you want to attempt natural childbirth, maybe you and your doctor can come to a compromise where you have the epidural placed but not dosed, so that if some emergent situation arises, they have the ability to dose you quickly, but you were still able to attempt a natural childbirth. I have a feeling that whatever OB you talk to will give you the same advice purely because their goal is a healthy mom and a healthy baby, and these interventions are necessary to help us achieve that goal. If you have more specific questions about your situation, though, feel free to talk to your doctor, or you can ask me any other questions you have, and I'd love to help you with it. Good luck with the rest of your pregnancy, and if you do have more questions, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.